Welcome to the Bipolar Buzz podcast, where we slice stigma surrounding mental illness one episode at a time, and we give others courage to do the same. I am your host, Lay, a wife, mom, daughter, sister, coworker, and friend who also lives with bipolar 1 disorder. So, without further ado, let's slay. Hey, what's up? In this episode, I'm going to be talking about actress Taraji P. Henson's nonprofit organization called the Boris Lawrence Henson Foundation, and it is named for her father, who was a Vietnam War veteran who later suffered from mental health issues that he was unable to get appropriate care for, and didn't have the resources that he needed in order to recover and to improve his mental health and well-being. So Taraji is actually working to improve mental health resources within the Black community specifically. And a few of the goals of her nonprofit organization is, one, to increase the number of mental health care professionals who are Black. So she's offering scholarships for people who want to pursue that route. She also wants to reduce the recidivism rates of people with mental health issues. So basically trying to prevent them from going back into the prison or jail system. And then she also wants to increase cultural competency among mental health professionals, which is something that is so important just in the medical profession broadly, but also specifically for mental health as well. And one of the initiatives of the Boris Lawrence Henson Foundation is called Meeting You Where You Are. And as part of this initiative, she is launching what she calls wellness pods on historically Black college and university campuses, HBCUs, in order to increase access to mental health resources that are culturally competent, and also to provide spaces for students to decompress when they are experiencing lots of stress or anxiety. She's offering therapy sessions at these wellness pods, and also things like yoga and other kind of self-regulating practices, meditation, in order to improve your mental health and your mental well-being. So the wellness pods, they have she care pods, they're going to have he care pods, and also they care pods. So she's making these pods that are specific. They are specific but still inclusive, and I am just excited to see the differences, I guess, between the she, the he, and the they care pods, because I think that gender does play a big role in the manifestation of different mental health issues and disorders, and also in how we deal with those issues that we might be experiencing. I think that gender plays a big role in just societal expectations and societal norms, so to speak, play a lot into that as well. So I think that she's really done a lot of research, and she's got people on her team who are really helping to make this program one that is not just available, but also effective. That's what we need. We need effective programs that target communities that are kind of, marginalized or on the outskirts, and can bring resources to them. I think that that's one step towards providing care that is specific and individualized. So she launched these She Care Pods, and the first kind of set of She Care Pods actually launched on the Alabama State University campus in Montgomery, Alabama, where I am, and this was last Friday, so Friday of last week. And it was a big success as far as I understand. And she's planning to launch more pods in other HBCUs as well. And so this is Taraji P. Henson, along with her organization, the Boris Lawrence Henson Foundation, and also Kate Spade New York, are all partnering to make these wellness pods a reality for Black students. And I'm just excited to see where this organization is going to go. And so right now, our focus is on Black students on predominantly Black campuses. And so I'm just curious to see how she's going to implement wellness pods and other ideas for other members of the Black community who might not be students. So how can we meet them where they're at? And I'm excited to see that. And I also love that one of her goals is to reduce the recidivism rate, because that is something that's not talked about a lot. People with mental health issues a lot of times are in the criminal justice system, and for reasons that probably could be prevented with appropriate resources. And I think that wherever she's going to take that is going to be a really awesome thing. So yes, I am in full support of this organization. I think it's awesome. I think it's much needed. And I also really like the cultural competency piece, because as someone who utilizes mental health care myself, I did find, so my very first therapist was a Black woman, a Black PhD, and I honestly do believe that she helped me in a way that maybe somebody else who looked differently than me or who was not culturally competent could not have helped me. She focused on me as a whole person. And so I was able to talk to her about things that maybe I wouldn't feel as comfortable discussing with someone else. And so we talked about not only my mental and my emotional health, but we talked about my physical health. We talked about things that stressed me out, things that made me anxious, and how we could take care of me as a whole person. And that was very important. I also had a Black psychiatrist, and this was at the counseling center at the graduate program that I was attending at the time. And, since then I've seen a lot of therapists, and none of them compare, honestly, to the Black therapists that I have seen. It's just a very different experience. And when you can relate to somebody, on a more personal level, I think that really does help in your mental wellness and your mental health recovery. So I think that she's really approaching this in a way that is very beneficial and helpful for the Black community. And I'm excited to see how it grows and to what other campuses she's going to go to. So that's a great thing about it too, is that she's increasing access to mental health resources, and by providing them on the actual campus where these students go and probably spend most of their time, most of their days as college students on that campus. So she's bringing it to them and also catering to them as Black people, Black women, and offering these pods and resources to destigmatize mental health by increasing access and making it something that is just a normal part of life, because mental health is a normal part of your health. And I was reading an article in the Montgomery Advertiser. I was curious to know why she chose Alabama State University, because she's actually a graduate of Howard University in DC. So I was curious to know why she chose Alabama State. And the reason is that Alabama State has already had a mental health initiative, and so it was just easy to kind of combine their ideas and their resources, and to just kind of maximize what they already had in place and to just take it to another level. So I really love this idea. I'm hoping that I can actually get down to the campus and just kind of see the pods for myself, and maybe even come back and share with you guys like what is going on at ASU's campus and how students are responding to what they're doing as far as mental health and mental wellness. Thank you for listening to this episode of the Bipolar Buzz podcast, where we have the courage to slay stigma. If you like what you heard, be sure to subscribe for more and share with a friend.